Okay.
All right, my friend.
Hello.
Hello. You got anything on your mind today that you want to talk about?
Well, I was thinking about exercise because in the last few months, the challenge has been to, do an assessment that helps you find out where the weaknesses are. Sometimes there's no real obvious key link, but at the same time, the patient is struggling with the exercise. You have gone through the sequencing of our approach, but you have not got to find out if a muscle, though it is functioning well, it will give you a strong isometric answer, which means it is well coordinated, but not strong enough to do the job you are asking it to do in function. So
Mhm.
just because you test a glutamedius strong does not mean it will pass a single leg stance without a Trendelenburg.
Right.
Because if it is weak in the sense that it cannot tolerate the load, it's going to show you that it is weak. So the only thing the muscle test tells you is that this muscle is coordinated and will give you, is competent to give you an isometric contraction and has the ability or capacity to get stronger with applied loading. But it doesn't mean that this muscle is 100% strong and will tolerate anything thrown at it. That's not what the muscle test
Yeah.
does.
I mean that's always, first of all, that's assumed and implied by the muscle test. I
Mm-hmm.
mean, obviously the manual muscle test has limitations. It's not
That's
a
right.
total test. I mean, first of all, it's an open chain test. It's not a closed chain test.
Yeah,
So
that's
and
right.
and of course we all know most of the problems are a problem of closed chain function.
That's
So we're
right.
testing the muscles in open chain.
Mm-hmm.
Um, and so there's that limitation. And like you said, there's a difference between isolated as best as we can versus coordinated muscle chain activity
That's right.
in particular planes in particular
That's right.
ways under particular loads. Uh, so let me ask, you know, you did clarify this and said, if the muscle is failing under function or um, under a test, I guess my question was, how are you specifically, identifying and saying they're failing this exercise or they're, I mean, I guess, well, how are you identifying this
So
muscle
let's
failure?
say that you have a muscle. You want to do oblique sit to quadruped, or you are doing a bridge, and the person is dipping down on one side. And you go, okay, could it be? You go back and you test individual muscles, or you put them in positions where they have to functionally isolate this muscle. So it might be that you can have the patient start with the the side bridge lift, not the bridge itself in supine, but side bridge lift, and see how easy it is for the patient to push through their knee and lift their hips from the floor. Or can
Mhm.
they do it 5 times on one side and 5 times on the other? Or you could have someone actually do a like an isolated clam. Now, I'm not a great clam exerciser by any means,
Sure.
um, but there's there are moments when certain tests or certain movements can be isolated to particular areas of the body that are testing the ability of a muscle to function in a certain vector. And so it is not only, even just like we said, you could have a single leg squat and you would see the hip shift out and you go, that looks like a gluteus maximus problem. Or you see instability of the knee, or you see a Trendelenburg and you say that looks like gluteus medius problem, etc. And then you must isolate each of these muscles as best you can and see if they have resilience, they have endurance, so that you can then say, okay, this muscle needs to be activated, it needs to be loaded, and it has to be loaded in a way it can't escape its job. So then you can go back and choose a DNS posture-based exercise. But you have to know the planned movement pattern so well that you can force that muscle to work as the primary agonist or close to in that movement. Otherwise, it escapes and somebody else, some synergist, takes on the job, and you are no further along with the problem than you were. And so that is really sometimes the question that the clinician is faced with. Do I have a DNS exercise? I have an orthopedic exercise. I have a muscle that is weak. How do I bring these three things together? Because I may not know how to modulate the DNS exercise well, but I've seen an orthopedic exercise that is very simple, that targets a particular muscle. And now I have to meld it and bring it into the DNS fold in a way that I establish fixed points for it. I establish a mobile point. I establish a canister, and so on. And the exercise may be part of a transition movement or a positional movement or transitional movement. And then you have to make sure that the person can feel this particular muscle or muscle group acting and working in this particular exercise. Because as we know, it is really important that the patient feels the muscle in question. That is what differentiates an exercise that will be integrated into the CNS versus an exercise that does not achieve that goal and fails to elicit the kind of response or qualitative response we're looking for.
So, yeah, I mean, it sounds like, if we took it with just a practical example of, patient comes in with low back pain. I mean, the common, obviously, the low back pain patient. And upon an initial examination, you find some hip range of motion issues on one side. You find some general muscle weakness of the muscles of the hip on that side, including things going on with their low back. You initially kind of what we would kind of describe as like desensitize the patient so that muscles are beginning to be facilitated. Their low back is not so sensitive anymore. They have a restoration of some range of motion. They're not so pain sensitive anymore. You get them to start to breathe and brace through the canister, and then you start to initiate. Well, I would back off and say, and at that point, you can then start to test some muscle chains. And this is all in terms in the context of the assessment that we teach and we ascribe to. Now, at that point, with our little example here, are you saying the patient will pass those muscle chain tests, but then when you start to place them into exercise positions, they fail?
Yes. So I have a strong chain, but it needs to be loaded in a particular way for the ADL failure that the patient came in with. Yes.
Okay.
Let me give you a easier
Yeah.
example.
Okay.
Let's say somebody.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.